Okay, my name is Sherry Morris. I was involved in a car accident in September and started coming to Dr. Ivey. Main reason was because I didn't want to go to a medical doctor and be taking drugs that made me sleepy or drowsy because I do have to work. And a little apprehensive when I first came and not sure of what was going to happen, but I felt comfortable right away coming into their office because the people in the front were a whole lot nicer than when you walk into a medical office. Everybody here was really nice and made you feel comfortable. Dr. Ivey did the x-rays and located my problem and started treatments, and now I'm being able to do things that I wasn't able to do. I feel like maybe I'm not 100%, but I don't think I will be 100%, and I think he's done everything he could to make me as good as I can be. I do feel a lot better than I did when I started, but I just really feel like they've done a wonderful job. He's been great. All his girls have been great. They don't make you feel funny when you walk in. Everybody's really friendly, nice, and they go out of their way to make you feel comfortable and do everything they can to help you. And I don't feel like I'd be where I am today if I had gone on to just medical treatment, because that was covering up the problem rather than doing something about the problem. And I feel like by coming here, I got something done about the problem, and it addressed the situation and did something to help me feel better.
Well, see, the amazing thing about you, Sherry, was that even when you were under care, even from the very beginning, you tried to continue to work, and that's one of those things that irritated and aggravated your problem, was the sitting that you were doing and the neck flexion stuff that you were looking down, the computer stuff. But this was a new job, and you certainly didn't want to lose that opportunity of losing that job, right?
That's right.
And we explained that to you, and we kind of told you, how to do the workstation and stuff like that. Could you tell a little bit about that?
Well, I did make some adjustments as far as moving my monitor, computer monitor, to where I could see without having to bend down. I tried to arrange it where I didn't have to be down doing a lot of filing at one time. I tried to do that, spreading it out so that it didn't bother my back. I didn't have to do a lot of stooping or bending, so that helped a lot too. But I did have to make some adjustments at work.
Yeah, and then you did the home care instructions that we gave you and stuff like that too, and how that improves. And then we told you too that, after you have a trauma like this, it's going to take, a year to 18 months for your body to completely heal. And that's why you sit up on a supportive care. So whenever it starts bothering you, that point, then we'll check that. Were you pleased with the treatment? Was everything explained to you efficiently and effectively, so you kind of knew exactly what was going on?
Yeah, I felt really comfortable throughout the whole process, because I felt like you and the girls did everything, told me everything I needed to know, and when I had questions, y'all always answered them. You didn't just bypass and say, well, we're the doctor, we're treating you, don't worry about it. You all always explained it, and that helped a lot. And I did have a lot of questions.
Yep, and that's important to understand. But you had questions, you just wanted somebody to answer them, and you didn't want the problem to be hidden and covered up with taking a bunch of medications and stuff like that wouldn't have fixed the problem. It just kind of give you some temporary relief.
Right.
And we were able to do that without all that medication.
Without the medication.
Well,
that was very important.
Right. Would you? Let me ask you this: would you refer other people to our office and with the treatment and everything that you received?
I already have. I definitely will, and already have.
Any last comments there about us, the office, people that anything they should know or want to know about us and your treatment and how we treated you and how the staff treated you, that kind of thing?
Well, I'll just say from the first minute I came in the door, the girls at the front were very attentive. They weren't trying to brush you off as just somebody making them have to do a job. They were here and they cared. And that meant a lot, because sometimes when you walk into medical offices, you don't feel that.
Yep.
You really don't, and I'm being honest, you just don't feel that. And when I came in here, all the girls, I feel like I really know all them.